Thank you, Julie, and thank you for inviting me for sharing some of the work that our team is doing. Before I start, I would like to acknowledge my team who has done all of that work, and advisory committee and working groups who have contributed their time and effort in working and developing these resources, and funding from Public Health Agency of Canada. So I would not go into the details of these, but just would like to highlight one thing. With all new direct acting agents which are well tolerated and highly efficacious, if we are not able to diagnose individuals who are not already diagnosed and not bring back individuals who are already diagnosed but not engaged with care, we cannot benefit from these highly effective drugs. So we need to have a mechanism to bring these people and get them engaged with the care and retain them in the care. And that's where, so this slide is very similar to what Jason talked about, and so it's a nice segue. So this was the project that we did in 2011, 2013, doing some qualitative work to assess some of the factors that are related with non-attendance for care or engagement with care, and looking at factors at individual, provider, and the system level. And 6 main factors were identified: cost versus benefit, competing priorities, stigma. At individual level, perception of stigma and actual stigma, and then at provider and the system level. And when we looked more in depth at provider level, it was mainly primary care, not mainly by specialists, because they are more aware about the Hep C and related issues. And then knowledge gaps at individual level as well as at provider level and at the system level, and access to care and restrictive policies related to access to drugs, referral, and appointments, and so on. So based on all of the learning that we did in this project, it was decided that we need to address some of these factors that are impacting people for seeking care or not attending for care. And we developed a national collaborative network of people who are providing care for hepatitis C or who are affected by hepatitis C, and these partners then help identify, based on the work that we did in the qualitative phase of our study, some of the factors and the factors that they already knew from their work. And based on that, we identified some of these factors to be addressed in our educational and support resources. And then in the next phase involved development of these resources, which our team started developing resources and working with these collaborative networks. We refined these resources, then tested and validated these resources. And some of the advisory committee members, some of you are sitting here in the audience today, and some may not be. And then Aboriginal Working Group and Immigrant Working Group, which are 2 current ongoing work groups that are in process. Aboriginal support resources are close to finalization, while work that we are doing with immigrant group just started for Punjabi population, and then we'll continue with some of the other groups. So I will come to now actual resources that were developed and how they are laid out across the cascade of prevention and care. So in this cascade, it starts from general population, where health promotion and prevention is an important part, and then you have at-risk people who are getting tested, then Hep C positive, and through entire cascade, developing, getting cured after therapy, and then people still need to be followed up and provide health promotion and prevention services for preventing reinfection. And along this entire cascade, we have resources, like starting with the initial part, we have resources related to frequently asked questions, and then along the full cascade, an online course which addresses resources, starting from how hepatitis spreads, what are the signs and symptoms, treatments, and support care, and so on. And then in the middle part, where people who are at risk or we need to screen them, tests for diagnosing hepatitis C, and then resources for providers to provide a pre and post counseling. And I will get into the details of these resources. And then once people are diagnosed, then resources around question that patient or clients could have from their providers, and the guide for getting ready for Hep C treatment, and so on. So getting into the nitty-gritty of these resources. So the first part for general population and the people at risk, they are mainly frequently asked questions, which are a bunch of questions that were developed working with people who are affected with hepatitis C. And all of these resources are available in English, French, and adapted for Aboriginal people working with Aboriginal working group, and then now in Punjabi language, adopted both in a cultural perspective as well as for the language perspective, and then being adapted to the other. And then in terms of format, some of these are available in print, other are available in videos, and some are available in both of these formats. So in the next stage, these are the images of resources that were that are related to testing. So first, the first resource is for individual patients or clients, and that provides them a kind of what kind of hepatitis C related tests are available, and then on the back it provides more detail about the other tests. And then this is the checklist for pre and post test checklist for providers, and this helps answer some of the questions that provider needs to talk with their patients. And this is for antibody test, and on the back side of this is for RNA related tests. And then going to the next stage, so these are the questions that that help patients to start discussion with their providers about their hepatitis C disease. And then we develop a skill building workbook that help and empower and support individual patients to have a discussion with their providers and seek care and the kind of care that they need for their illness. And then previously, as you know, treatments were quite bad in terms of their adverse effects, and a lot of things had to be in place before you could get on therapy. So getting ready for Hep C treatment guide was developed. So these resources are being updated to for addressing the changing landscape where adverse effects may not be as important, but although we are in the transitional phase at the moment where some of these things are still applicable, but these will change shortly. And then in terms of resources across the landscape, we have an online course which provides details on all aspects. And then we have recently developed a website which employs a quick navigation hub where you can go to the website, and then currently in the navigation you have English and French, and then other resources are being developed. And you can click on that particular piece or the particular button, and then it will take you directly to that particular point, and then resources that are available in videos as well as in text format and then printable format as well. So another important piece of work that we were working was based on initial work and then the literature review. We thought like we need to develop a behavioral framework that can help us understand like how these factors at individual level and at the broader contextual level are interrelated with that. And that will help us inform in terms of resources, where are the gaps, and then how we can deploy intervention and how we can evaluate these interventions. And that will be used for some of our upcoming work. So currently resources are taking care of factors related to knowledge, self-efficacy, perceived susceptibility and severity at individual level, and then perceived barriers and costs related to treatment and illness. And further resources will be developed as we are identifying these gaps. In terms of the future plans, we are updating these resources to reflect the current changing treatment landscape. We are doing some more focus group with immigrants to learn some of the factors that may be inhibiting them from accessing care or getting engaged with the care or getting screened, and then expand resources to other language and immigrants groups. And we are setting up a quantitative study to get a better understanding of these factors and how they are interrelated based on our behavioral framework, and then track these factors on ongoing fashion to see like how these are changing with the changing treatment landscape. And just in summary, we have been able to produce, set up a national knowledge translation platform that take research findings and develop resources, help patients and providers, and support them through their care. And resources are available in multiple languages, in English and French, and adapted to Aboriginal and Inuit population, working with these groups. And are in the process of being adapted in Punjabi, and then they are available in video, online interactive courses, and downloadable format. And the website have all of these resources available. Go and check this website, and you can use some of these resources if you are setting up a study for evaluating some of your interventions, similar to what Jason did. These resources could be used in setting up some of these kind of studies in Canada as well. Thank you.